Hey, are you trying to do back extensions to get relief for your back pain problem? Stop it right now. It's actually probably a very, very bad thing for you. In 9 out of 10 back problems, you don't want to be doing back extension exercises. It's way overdone and it actually feeds into the original problem. I'm going to tell you more about this and what you should be doing instead of back extensions to treat your back pain problem. Real quick, my name is Dr. David Midoff and I'm a specialist manual physical therapist. I work out at El Paso Manual Physical Therapy, and I've been helping out people on the internet as well as here in the clinic for years with back problems. And let me tell you all about back extensions. It is way overdone. As a physical therapist myself, I see tons of physical therapists giving their back patients, the patients with back problems, back extension exercises, all kinds of varieties of them. The ones where you lie down on your stomach and you push up like a cobra, or you might even hold up like a Superman stretch, or even just in standing where you lean backwards and you push backwards like this. And the idea is to work the muscles that are right up and down the sides of your spine to get the back muscles stronger or moving better. And it kind of makes sense if you think about it, especially if a physical therapist is telling you do these back extension exercises in order to help your back problem. Because if the pain is on the back, where your back hurts, then it would make sense to work out the muscles right by the source of the pain, or where you feel the pain more so. And the reality is, though, that if you think about the spine and the way that it moves, you can Google an image of a spine. If you just think of all the vertebrae and the bones or the vertebrae and the muscles that are right up against the back, when you do back extension exercises, here's why it's not a good thing. When you do those exercises where you move backwards, you're actually compressing the part of the spine where you're going to get the joints pinched, the nerves pinched. You're going to actually feed into the problem. Now, there is evidence, scientific evidence, and you might actually have had a little bit of success doing back extension exercises in the short term. There's some evidence showing that back extension exercises can reduce pain briefly for a short time. But if you're looking for long-term relief where you fix the back problem for good so that you're not having to deal with it again next month or in 6 months or in a year or two, so that you can avoid having some disc herniation or some sciatica problem or some other pinched nerve issue coming from your low back, then you don't want to be doing back extensions for that. Now, where back extensions might be a good thing is if you're lying in bed and you're just in a lot of pain in your back and you're afraid to get up because it might get worse. And you're thinking, gosh, I just don't want to have to take pills right now. I don't want to have to take medications. I don't want to have to call up the doctor about getting an injection. Then back extensions, if you have nothing else to do, might be an option at that point. But if you're looking to fix the back problem for good, like I was saying, for the long term, for months and years and indefinitely, then do not do back extensions. Do other stuff, which I'll tell you about here in a moment. Before I go into that though, I want to explain to you about muscle imbalances. And just real quick, I've got another video that goes deep into muscle imbalances. I'm just going to give you a quick brief intro to it and how it relates to doing back extensions and why it's not a good thing for you. But if you look in the description below, you'll find the link for our video on muscle imbalances for lower back problems. But in most muscle imbalances, especially for lower back pain problems, there's muscles on either side of the body that influence how joints move. So in the case of the spine, of the lower back, you have muscles in the back of the spine and then you have muscles in the front, which we don't talk about too much, but those are the abdominal muscles. There's another muscle group, the hip flexors, that also attach to the spine. But let's just think about abdominal muscles on the front of your spine. So those muscles do actually wrap around and have connections to your back, and they can influence, or they can help control the position of the back and the movement, which goes into the forces put through the spine itself, through the joints of the back, through the discs, and all the other surrounding tissues, the nerves, muscles, tendons, ligaments, all those other things. So if you have a muscle imbalance, here's simply put what it is. Muscles on one side of the spine are too strong relative to the ones on the other side of the spine. Those are too weak. And if you go further strengthen the strong muscles, in this case, if you already have very strong back muscles, even though they don't feel strong right now because you might be having spasms, if your abs are weak, which most people agree on, it's rare that you find somebody that's like, I have the strongest abs that I know. But most people will say, yeah, I hardly ever work out my abs and now I've got this back problem. If that's you, then chances are that you've got a muscle imbalance. And if you go strengthen just your back muscles without working on your abs, then you're going to feed into the muscle imbalance because you're going to be further strengthening the back problem. The reason why people get relief in the short term from doing back extensions is because you're just putting in a different sensation into the back. You're wiggling the joints a bit, you're loosening up the nerves, you're changing the pressures in the spine. And so momentarily, for maybe a day or a few hours, you might get some relief. But like I said, it's not fixing it for the long term. It's only going to further strengthen those back muscles and then set you up to have that pain again later on once you stand too long or sit too long or bend over wrong or pick up that thing that's just a bit too heavy for your back to take today. So what to do instead? You need to start working on your ab muscles. With clients that we see here personally, in person in the clinic, about 9 out of 10 of them, we're working on abs intensely. Now, I've got another video for you that goes over 3 quick exercises for lower back pain, also linked in the description here below. You can check out some ab exercises on there. They're ab exercises that we recommend our clients start with whenever they're seeing us here in person. But you've got to work your abs out, and I would actually look to avoid using your back muscles. Now, we've had some clients that come in here and they say, I've actually read the research and I know that it says that abdominals are where it's at as far as improving back problems for the long term. But I went and did sit-ups, I went and did this exercise and that exercise for my abs, and it actually made my back problem worse. We hear this all the time, and we troubleshoot it here in the clinic. There's a very specific way to make sure your abs are working so that you can get the relief that you need for the long term and reverse that muscle imbalance so that you're not suffering with these big back muscles that are putting way too much compression and bad forces on the back part of the spine. Now, you might be saying to yourself, well, I've tried abdominal exercises and I've done the back extensions and I've tried other stretches that I found on the internet or recommended by friends or family or even healthcare experts. I've been to physical therapy or chiropractors or doctors, physicians have told me what exercises to do as well. And it's just not working for me. What then? What do I do then? What else could be going on? Well, let me list a few things for you. It could be that even if you're doing the right type of exercise, your joints in your spine, especially if you're the arthritic type or the stiffer type, if you're genetically a stiffer person, you're not that flexible, or your family history is you've had people that have had arthritis or they're also not flexible, then your likelihood for getting stuck joints in your lower back, really all over your body, is going to be higher. Some other characteristics of these people is their joints pop a lot. Like they can get up in the morning or get up after sitting for a while and their knees pop, bones in their feet pop, they turn their head and shoulder and neck joints will pop as well. That's me. I'm a stiffer person genetically, and I just pop and click whenever I move around. Now, the downside to having these genetics is you're definitely going to be predisposed to getting arthritis if you don't take care of yourself. But if you're healthy and active, you're avoiding having these muscle imbalances, then you should be fine. You should live to be old and not have to suffer with problems related to arthritis. And if you have these stuck joints, what I recommend is going to go see a specialist who can by hand free up those joints. I'm definitely biased towards manual physical therapists, but there are chiropractors that can do a great job out there as well. You just got to find who works for you. Here in the clinic, we are very good at isolating specific joints and telling you where some are stiff and some are looser. And the problem that we find oftentimes in patients whenever they come in for lower back pain problems and they have very stiff joints is there's a lot of joints in the back, and we have to check each one because oftentimes there's one that's way too loose and then one nearby that's severely stuck. And if we go do like a chiropractic aggressive adjustment, it is possible that we don't actually loosen the stuck joint, but we overstretch the already loose joint. So it has to be handled with care and finesse. We have to time it right as well. It's a process and a procedure. It's a process to get this done, and that's why when patients come in here to the clinic, we're telling them right off the bat, this is not going to be a quick fix. We usually need to free up joints gradually over time to get the best long-term effect. Another thing that you might check if your exercises and stretches aren't going well for you is your technique. Abdominal exercises are gold for lower back pain problems, but if they're not done right, then they can actually hurt you. And making sure that your upper abs and lower abs are working right is a big deal. Here in the clinic, what happens oftentimes is we show people an ab exercise and they're using their upper abdominal muscles way more than the lower abdominal muscles, and oftentimes their lower abdominal muscles just aren't active, and they aren't aware of that. They're like, when we bring it up to them, they're like, nobody ever told me this. I didn't even know that I had muscles in that area, that I've never felt a burn there. Even competitive athletes that do a lot of ab work, we've found that their lower abs are kind of shut down and not working right, and that's what's feeding into their back problem or hip problems as well. So make sure that your technique is right. Revisit where you learned that technique. If you're using a specialist like me, if you're looking at our videos, then go back to that video and make sure that you're doing everything just right for you so that you can get the technique down. That way you can definitively say, I did the exercise just right, it isn't for me, and there's something else going on. Which brings me to my next point. There might be something else going on. It might not just be purely a back problem. Maybe there's some systemic issue like a rheumatoid arthritis problem, an autoimmune issue. There's a slim chance that that could be going on, and usually you'll know about that because there's other symptoms besides back pain and nerve pain. It could be also there's a nerve problem like a sciatica issue that's causing a back problem, because the nerves can send pain up as well as down. More commonly we see it go down, radiating down into the legs, but you can have a hip issue that's causing problems up into the back. And if you're just looking at fixing a back problem, but you also have a hip problem or even a knee or ankle and foot problem, then it could be related altogether as far as the hip, ankle, knee, foot, and feeding into the back problem. So that has to be thoroughly investigated. You might get an expert's help, or if you feel like you can self-diagnose your way to the problem and address it, then you can take your chances that way too. But just be aware that it may not be purely an isolated back problem. It could be other parts of your body or other tissues within your back feeding into the issue, and the exercises alone may not be the only thing that's going to fix the back problem. The last thing I want to leave you with that could be stopping you from improving despite you trying abdominal exercises, or if you did do back extensions, find out that didn't work for you either, or any other stretches or movements that you've been doing for your back problem. It could be that it's the intensity as well. We find this is often a problem with patients, is they'll start doing some ab exercise and it didn't really hurt them necessarily, it didn't bother them, but they didn't see an improvement either. Their back problems still bother them later on. And once we are going through treatment and we figure out what's going on, we find that they actually needed to increase the intensity of the exercise because it was a good exercise for them. It's just that they weren't getting stronger because they weren't challenging themselves enough during that exercise. Oftentimes, in order to reverse that muscle imbalance, you need to increase the strength in those weaker muscles. And the best way to do that is by increasing the intensity. It's the same exercise strengthening principles. I mean, if you want to be able to run a marathon, well, you got to work your way up to it. You're not going to just do it right away. Same thing with abdominal strengthening. If you want to have enough strength to throw off the muscle imbalance and put your back in a healthy position as far as your bones and joints, you've got to increase the intensity of the ab work that you're doing so that you can meet the level of the back muscles and take the pressures off the back joints and nerves and discs for the long term. So check your intensity as well. And what that looks like is it may be that you need to do more reps, do it more frequently, do it with weight in some cases, advance the movement or the technique. There's all kinds of variables to play with. Of course, if you're looking for exercises on the internet right now and you're trying to figure out what to do, you might look for that. If you're working with a specialist, they should know how to progress you in your specific situation. So before we go, I just have a question for you. Have you tried back extensions for your back problem? If you're watching this video right now and you've tried them, please drop a comment on here and let us know how it went for you. I'm interested to hear if it was a good experience or not so good experience. And also, have you tried abdominal exercises, or have you tried both? Please drop a comment on here and let us know if it's been good or bad for you. I'm telling you what the research is saying here, but I'd love to see what those of you out there have tried so that you can let the public know, what's your experience? Has it been good or bad doing back extensions? Have abdominal exercises helped? Give it a shot and please try it out and leave a comment. And please, if you thought this video was helpful for you, give us a like, hit the thumbs up button right there. And if you want to get notified whenever we release a helpful new video for you to get your back better as well as other body parts, please hit the subscribe button right over there so that you can get notified. Hit the bell, the notification bell right next to it as well, so that you are first to know when we release our next video. Thanks so much for watching, guys. Have a wonderful day. Bye-bye.